Hi, it's Sonia Jensen here from Jensen Insurance Agency. Today I want to talk to you about
one of the most confusing things about Medicare is enrollment periods. The enrollment period that gets the most attention is the annual election period, or AEP. But this has nothing to do with actually enrolling in Medicare. Today, I'll explain how to enroll in Medicare Part A and B. First off, you must do this through the Social Security Administration. Depending on your situation, there are 3 different time frames. There's the initial enrollment period, or IEP, when you turn 65. Now, you might delay Medicare completely or partially because you're covered in a group health insurance plan. Because of this, you can enroll later during what's called your special enrollment period, or SEP. If you miss both the IEP and SEP, your last resort is to use the general enrollment period, or you guessed it, GEP. So let's start with the initial enrollment period. Initially, Medicare beneficiaries have the opportunity to enroll in Medicare Part A and Part B during their IEP, or initial enrollment period, when they're turning 65. This is the 3 months prior to your birth month, your actual birth month, all the way through the 3 months after your birth month. This gives you a full 7 months. Just so you know, the start dates are always on the first of the month. Now, there can be delays in the Part B start date when submitting enrollment in months 4 through 7. For example, if you submit your online Medicare enrollment in month 6 of your IEP, your Part B won't actually start the following month. Rather, it will start 3 months later. So be careful when enrolling in Medicare during the final few months of that initial enrollment period. One final item to note: if your birthday is on the first of the month, you'll be eligible 1 month sooner. That means a July 1st birthday will yield a June 1st Medicare eligibility date. Okay, so to get enrolled in Medicare during the initial enrollment period depends on whether or not you're receiving Social Security benefits. If you're already receiving Social Security benefits, your red, white, and blue Medicare card will arrive about 3 months prior to your birth month. If you're not receiving Social Security benefits, you will need to proactively enroll in Medicare online at www.ssa.gov or call Social Security directly at 1-800-772-1213. Let's move on to the special enrollment period, or SEP. Your SEP takes place any time after your IEP ends and before you leave a group health plan. So, if you're covered on a group health plan based on your current employment or a spouse's, you can delay Medicare until you need it without penalty. Assuming the employer has 20 or more employees, this could be used anytime while you're working or up to 8 months after losing group health coverage, giving you a lot of flexibility on when you want your Medicare to start. I mentioned this can also be done without penalty, and that's because of your continuous coverage through a group health plan since the age of 65 based on the act of employment of you or your spouse. But after 8 months of separation from the employer, your SEP ends and you cannot enroll in Medicare again until the general enrollment period. Before we move on, it's important to note about COBRA continuation and retiree health plans, as well as Medicare based on end-stage kidney failure. None of these are considered coverage based on active employment. So, you'll want to pick up Medicare Part B within 8 months of your separation of employment to avoid a late enrollment penalty and delayed start date. Additionally, Medicare coverage due to end-stage renal disease is not a special enrollment period opportunity. We strongly recommend accepting both Medicare Part A and Part B when initially eligible for Medicare based on kidney failure. If you do not follow the rules mentioned above, you're stuck enrolling in Medicare during the general enrollment period. So, if you miss both the IEP and SEP, you must enroll in Medicare during the general enrollment enrollment period, which spans from January 1st through March 31st of each year. The application needs to be completed through a local Social Security office or by telephone. You will need the application for enrollment in Medicare Part B form, which can be located by typing in CMS 40B in the search bar at ssa.gov. Important note, when you enroll in Medicare during the general enrollment period, your Part B start date is delayed until July 1st of that year. If this creates at least a 12-month period in which you should have had Part B, you will be assessed a 10% lifetime premium penalty, and that penalty will be larger the longer you went without Part B. Now that we've summarized the enrollment periods for Part A and Part B, let's jump into the timeframes when you can sign up for a supplemental medical and prescription drug coverage. Here's where we get into when you can enroll in supplemental insurance plans through an insurer, carrier, Part D drug plans, and Medicare Advantage Part C plans. We'll get into Medicare Supplement Medigap plan later. When your Part A and or Part B is about to begin, you can enroll in Part D prescription drug plan or Medicare Advantage Part C plan. After that, you have one opportunity each year to make a plan switch. This is called the annual election period, which runs from October 15th through December 7th of each year. During this time frame, you can enroll in or switch a Part D drug plan or Medicare Advantage plan, with the new plan taking effect January 1st of the following year. If you're happy with your plan, no action is required. The plan will automatically renew for the next year. Now, to enroll in a Part D drug plan, you must be enrolled in Part A. To enroll in a Medicare Advantage plan, you must be enrolled in both Parts A and Part B. Let's finish up with our last enrollment period, the Medicare Supplement or Medigap open enrollment. The easiest time to purchase a Medigap plan is during Medigap open enrollment. That's because there are no medical history questions during this time. Your plan approval is guaranteed as long as you do this in the months leading up to your Part B start date or during the first 6 months of your Part B coverage. However, if you want to change to another Medigap plan, medical history questions can be asked and your plan approval is not guaranteed. Contrary to what you may have heard, you can actually change your Medigap plan any time of the year. The only wild card is whether you have to answer medical history questions. Is it during your 6-month open enrollment or after that? Now, we've covered a lot today, and you understand the various enrollment periods for Medicare Part A and Part B, as well as those enrollment periods for supplemental insurance coverage. No matter your situation, we're here to help.
This has been Sonia Jensen here with you today. You want to learn more? Click the button and subscribe below or visit jenseninsurances.com. Bye for now.